the icy cold water of the examination room's bowl making me wince. The blood, so dark to be almost black, was like treacle, coating my fingers and creeping beneath my nails, so that I had to scrub my skin raw to rid myself of it. Drying my hands on the threadbare towel hanging from the washstand rail, I turned back to the table and the body of the Coleman. The Coleman had arrived at St. Eustace's Free Hospital only 10 minutes earlier, wheeled through the teeming London streets on a handcart pushed by his mate. I had been on the point of leaving for the evening when the cart had burst through the large double doors of the hospital's entrance hall, and the driver had shouted desperately, "Somebody help me!" A plea impossible to ignore, I shoved my gloves back into my overcoat pockets and hurried over to him. I stared down at the man sprawled upon the handcart, his limbs dangling over the sides. There was a deep indentation in his chest, exactly like a rut in the road, and I knew he had been run over. His chest was crushed, and he was groaning, a scratchy, wheezing sound, painful to hear. London is such a busy city. Its roads are almost perpetually jammed with horses, carts and cabs, and that is without all its inhabitants milling hither and thither. Road accidents are a daily occurrence. I had been at St. Eustace's for almost a year, and apart from endemic diseases, traffic accidents were the most common reason for people coming to the hospital. The accidents varied in severity, from bruises to lower limbs where people had been knocked aside by vehicles, to broken bones where they had fallen beneath hooves or wheels. I had treated a variety of these, but had never seen an injury as terrible as this now before me. I could only imagine the pain the Coleman was suffering, and it made my stomach churn. What made me feel even worse was knowing there was nothing I could do to help him. "Nurse Brewer," I called, seeing her uniformed figure enter the lobby. She made her quick, confident way to me. "Yes, Dr. Cowdrey?" she asked, looking down at the Coleman with a disarming lack of emotion. "The examination room at once for this man, please. His friend can take him through on the cart." I followed Nurse Brewer and the handcart down the corridor and into the examination room. I watched as she commanded 2 male attendants to lift the injured man onto the examination table. The men groaned as they lifted him, and I bid them take care. Nurse Brewer steered the Coleman's mate out of the room and closed the door. She moved to the trolley and took up a pair of large scissors. "There's nothing to be done for this man, Doctor." I hung my coat up on the hook behind the door. "We must try, nevertheless, nurse." "Of course we must," she said a little testily. "But you must prepare yourself for the inevitable." She cut open the man's shirt, having to tug it away from the skin where the wheels had driven it in. She shook her head at the sight she revealed. "He cannot survive such an injury." She was right, of course, though I rather resented her telling me to prepare myself. I knew I had a reputation for weakness among the medical staff, and her words were simply a reminder that opinions of me were low. Nurse Brewer had been at St. Eustace's for 6 years, and seen far more injuries than I. Though no doctor, she could tell which patients we had a chance of helping, and which were lost causes. But I could not stand by and do nothing, even if I wasn't at all sure what I could do to ease my patient's suffering. With the rib cage sunken in this manner, the man's lungs would undoubtedly be crushed, probably even punctured by splintered ribs. To find out, I would have to open up his chest, something which I had never done before and which, frankly, I hoped never to do. Such surgery would probably kill him just as surely as his injury, and even if he did somehow make it through such butchery, there was no procedure I knew of that would restore his rib cage to its correct shape.